Chapter 4, Overcoming Stigma. Never believe that a few caring people can change the world, for indeed that's all who ever have. Margaret Mead. Vic was driving home from his office in a stop-and-go traffic, mulling over project due at the end of the month. Suddenly it struck him that he should drop by his church, not having any reason to go in the middle of the week. He shrugged off the thought, but over the next few miles, the idea kept returning, pressing at him. Vic decided that God must be directing him there, although he could not imagine why. He took the next exit, pulled into the church parking lot a few minutes later, and headed towards the entrance. Noticing a man seated on a bench in the adjacent patio, he paused. "Have we met before?" Vic asked. "My name's Vic." After a moment of silence, the man stood. He had a robust build, salt and pepper hair, and silver-rimmed glasses. "I'm Leland," he said, and the two shook hands. "It sure is a beautiful evening," said Vic. Leland cleaned his throat. "I guess so. To tell you the truth, I hadn't noticed." He sat back down on one end of the bench, leaving plenty of room for Vic, who accepted the unspoken invitation and took a seat. "Have you been with this church long?" Vic asked. "A few years. I've been coming for quite a while myself," said Vic. "It's an important part of my life." When Leland made no comment, Vic risked another question. "What brings you here this evening?" Leland nodded his hands, looked down at his lap, and drew in a breath. "I think I have Alzheimer's disease." Exhaling with a ragged noise, he crossed his arms over his stomach and doubled over. "I was at home thinking of a way to kill myself, and I decided to come here first. I don't know why." His face creasing with concerns, Vic put his hand on Leland's arm. "I'm so glad I stopped to talk to you. Please believe me that life is still worth living. This isn't the end. I know because my mother has Alzheimer's." Alice had begun calling Vic several times a day, asking him the same questions over and over. At first, Vic attributed his mother's forgetfulness to the pressure of caring for her husband during his battle with leukemia. Later, he attributed it to her grief at his death. She had been married to Vic's father, Big John, a renowned drag racer for nearly 60 years. Their lives were intertwined not only by their love and the two children they raised, but also by Alice's dedication to the behind-the-scenes aspect of her husband's career. The reality that his mother had dementia became clear that day. Vic's niece phoned him at work. She told him that Alice had run out of the house and fled into the middle of the street, screaming for the police. His niece followed her to get her to come back inside, but Alice swung her purse at the girl and shouted to leave her alone. Vic dashed out of his office to his car and headed for his mother's house. On the way, he called her doctor to describe the situation and ask what he should do. "She has anti-anxiety medications," the physician said. "Tell her to take it. But we aren't going to be able to get close enough to her to get her to do that," Vic said. "Then crush the pills and put them in some pudding and offer it to her," the doctor responded curtly. "You don't understand," Vic said, raising his voice. "She's taking a swing at anyone who approaches her. She's not about to stand there eating pudding." Jeez. "Well, the only other option is calling 911, the physician said. "The fire department will come out and put her in restraints. Then she can have an injection to calm her down." Oh, boy. Telling the doctor he was not going to subject his mother to a straitjacket, Vic ended the conversation. As he neared Alice's house, he began praying for the strength and skills to cope with what he was about to encounter. When he arrived, he found his niece and several other family members standing in a circle around Alice. Out of arm's reach, taking a deep breath, Vic approached the group. Alice looked at him in a calm voice. She said, "What are you doing here?" "I came to talk to you," Vic said, his tone matching hers. "Let's go inside and sit down." She nodded and followed him into the house. That was when Vic began caring for his mother in his own home. His experience inspired him to help others whose loved ones had dementia. As he led Alzheimer's support groups at his church, he began to understand something he had heard his pastor say: God never wastes a hurt. Vic found that providing emotional and spiritual support to other people brought him a sense of purpose that he had been lacking in his career and as a mortgage broker. As he began to wonder whether he could make a living by helping others deal with dementia, a friend referred him to Lawrence Shook. What was supposed to be a 30-minute appointment turned into a 3-hour meeting. Vic spoke with passion about the need to educate churches on dementia issues. The faith-based community could take on a major role in assisting individuals and families dealing with Alzheimer's. Lauren listened intently, occasionally nodding, and then spontaneously invited members of Silverado executive team to join the conversation with Vic. Silverado has since hired Vic as Senior Director of Faith Outreach to handle Alzheimer's education and to build relationships with churches. In affiliation with Silverado, Vic created the Mind, Heart, Soul Ministry at Saddleback Church, not only to serve the memory impaired, but also to provide education and support for the families and loved ones of those afflicted. Embarking on his career brought Vic a new phase into his life. Each day, he woke feeling he was making a difference. The next year, his mother moved to Silverado. Years later, Vic was certain she was living longer and more happily in Silverado's care that she would have if she had remained in her house, in his home, living longer and more happily. Okay. Leland, bearing that Vic's mother had Alzheimer's, sat back from his doubled over position. He didn't say anything, but when he turned to look at Vic, it was with encouragement for him to continue. "Why do you think you have Alzheimer's?" That I had a big presentation to clients yesterday, and when I got there, I realized I had forgotten all my notes. He said, and he paused, "It's the second time I've done something like that in the past month." Then I was sending a birthday card to my twin granddaughters, and I couldn't remember their names. Raising his hands to clutch his forehead, he added, "I can't imagine telling my family. What would my friends say if they knew? I'm going to be a useless burden on other people, a crazy person. It's better for everyone if I finish it now." Leland reached into his pocket to pull out a handkerchief. He removed his glasses, wiped them, and put them back on. Then he said, "Please tell me, how could that be possible?" Vic and Leland talked for almost an hour. Vic said, "God has our lives planned from the time we're born. He knows everything that's going to happen to us. He never wants us to hurt. He only wants to help us more like Christ. My mother didn't want Alzheimer's. I'm angry she has it. But because of Mom, I started volunteering to help thousands of people. If you have the disease, God has a reason, and He's the only one who knows the reason. If we're faithful and obedient, He will lead us to a fantastic future that we can't even imagine." Leland started crying and hugged Vic. "Thank you," Leland said. "I never thought of it that way." As they stood up to leave, Leland promised he wouldn't do anything drastic and that he would call for a doctor's appointment the next morning. They gave him his card asking Leland to phone him if he ever felt despair again. Leland agreed he would. Vic never heard from him. But several months later, in the friendly hubbubs after a church service, he noticed Leland on the other side of the large sanctuary. He was talking and laughing with a silver-haired woman, a younger couple, and two little girls. In 2006, Linda Haag learned she had Alzheimer's disease. She later wrote in an essay, "In my experience, it is at the point of diagnosis or shortly afterwards a stigma begins to appear. It is as if friends and relatives can accept and be amused by someone's foibles prior to the diagnosis and can warmly comment that they are getting eccentric. However, once dementia is diagnosed, it is as a line has been crossed, and some people don't want to be associated with an illness affecting the brain." Her writing appeared in Overcoming the Stigma of Dementia in 2012, a report produced by Alzheimer's Disease International, a global federation of associations dedicated to helping those with dementia. Surveying memory impaired and their families in 54 countries, the study revealed that more than 2/3 of respondents believe dementia carries a stigma. One memory impaired person answering the poll said people think those with dementia are crazy, mentally unglued, and unstable, and therefore to be avoided because how would you know how to communicate with them? Anyway, many people are afraid of dementia and want to stay away as far as possible from it as possible. It terrifies them. In a society that values youth, physical strength, prestigious careers, and fashionable possessions, the elderly and infirm lack status. As their conditions progress, they are stigmatized because there is less and less about them with which society can relate. Unfortunately, the stigma prevents many people from seeking early diagnosis. Lucia Datona, MD, who specializes in geriatric medicine at UCLA Health in Los Angeles, sees this reality firsthand. "I do believe Alzheimer's and other dementias have a stigma," she said. "The diagnosis can bring fear and shame. Often one of those first reactions is, what am I going to tell my family and friends? The stigma can even affect doctors. I've seen patients with obvious signs of memory impairment whose regular physicians have said nothing to them about it because they aren't comfortable with it," she said. "When I bring it up with the families, they ask me, why didn't the other doctor discuss it?" According to Joe M. Ramsdell, MD, professor and division head, General Internal Medicine at the University of California, San Diego, "When we can diagnose early, we're able to talk with patients and their families about how the memory impaired can still enjoy a good quality of life. We can explain what certain behaviors mean and give caregivers insight regarding what to expect." Early diagnosis also enables us to help the patient and family build a support system. It allows those with dementia to decide how they would like to live and to receive care so that they can be involved in determining their own future quality of life. When the memory impairment is detected early, there's also time to determine whether there could be any benefit in trying drugs to allow to slow progressions of Alzheimer's. Experts are tempered in their views of the effectiveness of new medications, or of these medications. Thank you, hon. Mm-hmm. Dr. Datoma believes they can potentially slow the disease's progress for as little as 6 months or as much as 3 years, but emphasizes that every person is different. Less optimistic, Dr. Ramsdell says, I'm largely disappointed by these medications. Data from tests shows very small differences in outcomes between those who take the drugs and those who do not. He often recommended that patients try the medications but discontinue them if they see no impact. He warns that they have numerous side effects. All medications do. Both physicians believe in the crucial role of the meaningful behavior-based practices as embodied by Silverado. Silverado's normalization approach fights stigma. When those with dementia are nicely dressed and groomed, they feel confident about looking good and participating in appropriate programs. In terms, this enables the non-memory impaired to relate to them better. In Silverado's surrounding communities, residents are seen practicing their putting skills with a pro at a local golf course, going to the theater, shooting pool, and grabbing burgers at a pub, delivering hand-knitted blankets to a shelter for women and children, and walking Silverado's dogs around the neighborhood. This breaks down social barriers and shows that memory impairment need not isolate people from the world. Silverado treats each of his residents like a human being, not like someone with a disease, Dr. DeTomo said. This approach is an important part of the solution to the issues of stigma. Slipping her purse over one arm, Vic's mother Alice leaves her room, headed to breakfast. She has only gone a few steps when Sonia intercepts her. "Good morning, Alice," she exclaims. How are you today?" "Fine, thank you," Alice answers. "And you?" "Just wonderful," Sonia replies, reaching out to touch Alice's hand with affection. She adds, "I'm even better for seeing you." Alice walks a short distance further and is again stopped, this time by Wilmer. "Alice, how is your day going so far?" he asks. "Very well," Alice says. "How are you?" "Fantastic, and happy that you are having a good day," Wilmer says. "Enjoy your breakfast." What could be a short walk to Silverado's dining room ends up taking Alice considerably longer. It will be like this all day as caregivers, engagement specialists, culinary team members, housekeepers, and the executive director stop to greet her and at times give her a hug. Memory impaired and in her 80s, Alice has blossomed since moving into Silverado. She has lived with her son Vic for 4 years, but despite their loving efforts, her family could not provide this constantly positive atmosphere that is such a tonic for her. Smiles, respect, and love are how Silverado fights stigma, and it's the way the rest of the world can overcome it too. And that is the end of Chapter 4, Overcoming Stigma.